pain is probably one of the biggest questions, and I explain to them, your pain will be different. You have pain now, but the pain you're going to have will be surgical pain. So it'll be a totally different. And I said, and our goal is to constantly monitor your pain, keep your pain under control. So I really encourage patients, if they've had a nerve block in their leg, I'm at the bedside the day of surgery. You're going to have a nerve block. As soon as you feel tingling in your leg, I want you to push the call light, and I want you to ask the nurse for pain medicine. We have scheduled medicines we give, but I really encourage them to constantly stay ahead because they are up walking with the patients the same day. And even post-op when they go home, I encourage patients to call me when they get home. So if they've been doing their pain medicine and they're like, I'm still having pain, I say, all right, well, let's talk through this. Tell me what you've done at home. Have you done ice? Have you been, propping your leg up? What's the swelling like? Let's go over what you have done. How are you taking your medicines? Are you taking Tylenol in between or ibuprofen? So I try to work through it, and if they haven't been managing their pain right with narcotics per se, they may have been, just because the bottle says every 4 hours doesn't mean we do it every 4 hours. You only do it if you're having this level of pain. So I really encourage them to try to wean off the narcotics as they go along. So I'll say, all right, if you had it at 10, and then we form a schedule over the phone, and they know how to do their medicine, and it helps. And they'll call me back, and they're like, oh, you were so right. You got it. It was right.